Beaven, how's your camera? We got one more person connecting to audio. So while we're waiting for everyone to get their devices together, I like to start off this meeting with some gratefulness. So I and the facilitators will go first. We'll talk about, we'll share our names and then something that we're grateful for. So I'll go first. My name is Robert Williams. Most of you know me. And I'm very grateful for the day. I'm grateful to be alive and I'm grateful for my health. Any other facilitator can go next.
My name is James Cook. I'm grateful for my daughter, my family. Y'all hear in the background, she's running around here being a terrorist, so forgive me. But yeah, I'm grateful for being here. Thank you.
I'm Marcus White. Certainly always grateful for my family and just being here today.
My name is Khaled Gade Harrison. I'm grateful for family, my daughter, and just grateful to see another day.
Good afternoon, everyone. My name is Daryl Howell. Just as many of you all express what you're grateful for, I share that as well too. I'm grateful to be alive, grateful for my health, but also I'm grateful for HHRC for hosting this event and allowing me to be a part of it. And once again, it is such an honor and a pleasure to be on this Zoom meeting with each and every one of you. Thank you.
So now that all the facilitators have shared what they're grateful for and their names, I would like for my participants to now share their first name and what you're grateful for today. Dennis, would you like to go first?
Oh, yeah. Hi, I'm Dennis. I'm grateful for, well, I guess just pretty much just being alive, being thankful for that. Because every day is like an opportunity to better yourself and learn from your past mistakes. Because it doesn't matter what you did, it's about who you are right now.
All right, what about you, Sean? You want to go next?
Oh, yeah, sure. My name is Sean. I'm grateful for my family. I'm grateful for my health. And that's it.
Of course. KJ?
Hello, my name is KJ, and I'm grateful for a lot. I can't even put it in words for real, but I'm really grateful for this opportunity today.
By you, Randall, you next.
Yeah, I'm grateful for friends and family, health, and very thankful for, transferring into college, with not really any roadblocks or any obstacles. I'm doing very well. So I'm very thankful that I'm able to adapt so quickly.
That's good to hear. I'm happy that you said you're in college too. That's wonderful, man. I applaud you on that. What about you, Rashid? You're next.
My name is Rashid. I'm grateful for health and clarity. Yeah.
You're all good, man. And finally, Beaven.
I'm grateful for my family and having a roof over my head.
Of course. Now, as you all know, this is a meeting based off of mental health during the pandemic, and I will let Daryl take it away from here. Daryl, would you like me to pull up the questions for the participants?
You can, but I have the questions available as well too, but if it's your call.
Okay. How about my other facilitators? Would you guys like me to pull it up or does everyone just have it to the side?
I'll pull it up.
I
Okay,
actually had,
I'll pull it up then.
I'm sorry, go ahead.
1 second. All right, so these are the questions we're going to be going over with you all. I will let Daryl take it from here.
Once again, good afternoon, everyone. We're gonna start with the first question here, which states, how has the pandemic affected your mental health, meaning home, outside, and work life? I'll start off with answering this question personally for myself. I can tell you the pandemic has increased my workload, especially as myself as a frontline worker, as an engineer in the healthcare and medical field. I mean, work for me has increased tremendously, which also has induced a lot of stress, which in this pandemic, many people have lost their jobs. But you know, and that's a sad part as well too, other than the deaths that have compounded the situation. But for me, it has been very, very busy. And we'll go down the line with the participants here as well. As a matter of fact, we'll go ahead and start with the facilitators, answer this question as well. And we'll move right into the participants.
How you doing, guys? For me, how the pandemic affected my mental health. I've always been a go-getter, been a hustler, been a worker. So I mean, I feel like I was born into a pandemic without it even being a pandemic, you know? Just by where I come from and just how much I gotta strive to make it, being, you know, a young African American and everything. So for me, my mental health, it changed a little bit just because I have a daughter. So I had to worry about another life. When you have to worry about somebody else, you can't always move the same way you move as you move like by yourself. So for me, it changed because of my family. I had to make sure they were straight before I was straight. That's just the type of person I am. Some people may not be like that. Some people may not operate like that, and that's totally fine. Everybody operates different. But for me, that's just how my mental health kind of changed. I wouldn't say it went bad or it went for anything worse. It just, I had to adapt. Not going out so much, not being around people, making sure I'm around the right type of people. So that's how it went for me.
Okay, I think I can.
Next, we got Mr. White. What's your thoughts on this question? This first question.
Okay, can you guys hear me?
We can hear you a little bit. If you're on your phone or your computer, you got to come a little bit closer to the microphone, which is at the bottom.
About now, I'll speak up just a little bit more.
Yeah, we got you better.
Yeah, a little better.
I apologize, guys. I had to have a quick change. But how my mental health has been affected during this pandemic is it's made me more aware of the things that I had been struggling with. It kind of brought some things that I was struggling with to the forefront, and it allowed me to start dealing with those things. And definitely my health was one of them, paying a little bit more attention to the things that were important to keep me alive. The things that were important to keep me alive. And just basically making sure my family was safe. I think my mental health was affected that way.
All right.
Okay. Can I add to that? I feel like the only stress a person really has is when you worry about somebody else. You know, you don't really have too much stress when you just you out there by yourself. It's when you like have other people counting on you, you know? That type of stress, I feel like it's a stress that really kind of like can't go over to the top or be a little bit too, less. So I think either way it goes, it could be either bad or good. You have to kind of meet it in the middle. But
I can definitely attest to that. Coming from the environment. Can everyone hear me? I just want to make sure.
Yeah.
Okay. So coming from, the pandemic, before I left in 2020 to basic training, the pandemic was still in the sort of like, okay, it's there, but it's not it wasn't called a pandemic. It was just like, okay, there's a virus somewhere. And as soon as I went into basic training, everything completely changed. And literally my life, my training, my family, the whole dynamic just flipped upside down. And I had to learn how to maneuver and how to sort of adapt to that change. And it was a process coming back home from being secluded from the rest of the world. It definitely had an impact. And like you said, James, when you have someone you have to worry about, it takes a toll. It pulls away from, okay, this isn't just my life now. Like I have other people's lives in my hands that count on me. Like, for example, when I came back home, I was in displacement. I didn't have a place to live, and I had to couch surf for a couple months until I found something. And then once I found something, I had to make a compromise with my family, and overall, I had to start taking care of business. So I definitely understand what you mean by that, and it pulled that survival emotion and that survival instinct out of me again, that I had when I was younger. Doesn't matter how it gets done, as long as it gets done. So I can empathize with that situation. What about you, Khalid? Or yeah, you next.
Well, everybody hear me loud and clear?
Yes, sir.
Yeah, so to be honest with you, I feel like I was already prepared because I've had a lot of trials and tribulations in my life. And so I feel like I was already equipped for, the adversity. But as far as like, I had a lot of concern for my grandmother because she's older, she has underlying health conditions. My mother, she's in the medical field, so she's in the hospital every day. So, I worried about them a lot. But like you say, the worry comes from, worrying about others, not always yourself. But besides that, I think I maintained pretty well. Towards the end of it, I found myself getting a little restless, wanting to get out and do the things that I enjoy doing. But how I maintain my sanity is just, just distracting myself with, reading, studying, things like that, things that I feel like will, add to me, add value to me during these times. So I will be, a better person when it's time to go back out in the free world,
Daryl, do you think we could start with the first participant now? I think all of our facilitators went.
Yes.
Okay. So I really want to hear from Dennis. I want to hear from you.
How's the pandemic affected my mental health? Truthfully, it didn't really affect me that much. The only thing I'm just doing is just more sleeping right now. That's the only thing that's just changed about me. But before the pandemic, I was going through some really difficult times in my life. I was trying to figure out what I want to do with my goals. I got into a bit of personal troubles, and I wasn't really that much social. So ironically, the pandemic hasn't really affected me that much. It's just did what I had to do, and I just kept going through life and just figuring out who I was, and just try to get to my goals.
Of course. All right. What about
I'll be honest, that's true.
Definitely, definitely. What about you, KJ? How's the pandemic affected your mental health, bro?
Well, it was kind of hard on me, I'm not gonna lie, at first, because a lot of my neighborhood, there was a lot going on, and I didn't have a job. Well, I had a job before the pandemic. It was security, but since COVID started, they got terminated. So like the job site wasn't there no more. So I didn't have a job for a couple months, and that was hard too. And I also lost a couple people that was close to me during the pandemic, not even from COVID-19, just from stuff that happened in the streets or whatever. So yeah, it was just a lot going on. But I ended up getting a new job, and I feel like it kind of made me stronger after this whole year or whatever, more than a year. It's kind of a lot been going on. It kind of made me stronger at the end of it. But yeah, that's about it.
That's awesome to hear, man. That's super awesome to hear.
Yeah.
Next is Sean.
Yeah. Overall, I think my mental health hasn't deteriorated or anything, but during the time during when it was like really big, it was really stressful. Not because of work or anything, but because, well, I was worried about my family. I was worried about my grandma. When I lived at my grandma's house for like an entire semester, I was really worried about whenever my aunt went out, because I didn't want her to get nothing and hurt my grandma. It was also frustrating not being able to see people that I wanted to see and do the things I wanted to do. Overall, like someone else said it, I think it made me stronger. I think like if something else happens, I don't know, I think I'd be able to handle it better than I did the pandemic. Yeah.
For sure. That's awesome to hear that your mental health it didn't deteriorate like you said. So that's really good. What about you, Randall? How's the pandemic affected your mental health, man?
In some ways, it's sort of helped, especially family wise, because our family, like extended and like family that I really have, we realize that like, oh, this pandemic's serious. Like people are actually dying at a large rate, so we need to just come together. And not saying that we weren't together, but we had to do school at home. My parents had to work at home. My other extended family had to work at home. So we had a lot more opportunity to chill together and do more things as one family than maybe we wouldn't have prior to the pandemic. And we just realized that, without that family bond, like there's a bunch of like your mental health can really be ruined and stuff. So I feel like in the family aspect, the pandemic sort of helped, but school wise and everything else, it sort of took a toll on my mental health because, we could see family, but, seeing people outside your family was, restricted. It's becoming like lenient now, but like I'm talking like the very first like lockdown and stuff like that. We couldn't go to any dances and I couldn't see my friends. So that really took a toll on me, but glad that, my friends are vaccinated and stuff, and we know what not to do and what to do. So I'm able to see them, and we're slowly getting back to how things were. But yeah.
For sure, man. For sure. Next, I would like Bevan.
For me, I would say it didn't like affect me too much because Nothing serious happened in my family or anything, or like the people I knew. So I felt like calm, but it did make me realize how important it was to go outside and interact with people.
For sure. And finally, Rashid.
The pandemic, probably, I wouldn't say my mental health hasn't deteriorated, but definitely a learning experience, a learning curve. Like everyone has said, learning how to manage your worries and manage stress while at home, you know, learning how to moving out of thinking with my head instead of thinking out of fear was a big challenge. But I think once people, get over that, you can accomplish a lot.
Okay. So the next question is, what has and hasn't changed in your daily lives? Since Daryl went first last time, I'll go first this time, and then we'll go back and forth through our facilitators again. What has changed in my life is, like everyone has said, I worry about my health and my family's health a lot more than I did a couple years ago. Watching my blood work more, finding out there's different doctors for different specialties. I started my chiropractor sessions. I started to think about not only my mental health, but also my physical health. Think about, what I'm eating. Think about where people are as far as, like, hey, where are the most rise COVID cases right now and why I need to stay away from that area. And a big one was my mom. My mom, she has severe arthritis, she has lupus, and she has a sciatic nerve pinch in her back. And what I've learned from the pandemic is that if you have underlying, health complications that can inhibit you to get the COVID-19 a lot worse than most folks who get it. For example, again, my sister's father recently passed due to COVID complications. He already had underlying health issues, but he ultimately did pass away from COVID. So definitely watching my family's health a lot more closely. And what hasn't changed is, my discipline, watching myself, making sure that I know what I'm doing, I'm moving right, I can still do the things I have to do. I just have to do them in a different way. So in a sense, my discipline hasn't changed, but worrying about health issues and my family's health issues has changed. I'd like for Mr. Marcus White.
Well, I would start by saying it has changed relatively everything.
Apologies, I can't hear you.
Okay, how about now?
Yeah. Better.
So the major change has been at work. I work in the medical field.
Mr. White, we still can't hear you.
How about now? Now?
It's a little better.
A little better?
Oh, there you go. That's a lot better.
Yeah.
Okay. So basically what the major change has been at work. Because I work in the healthcare field, we're monitored daily when we come in the building.
We can still barely hear you, Mr. White. We heard you clearly for a quick second here and something happened.
How about now?
When the phone is closer to you, we hear you a lot better.
I actually haven't moved it. I think it has more to do with the way I have it positioned. But is this any better?
That is for the recording, or for the live. It's okay.
Okay, I'm gonna speak a little clearer and go a little faster. So going in and out of the hospital has changed tremendously. We have one entrance, and we have we have to go through a rigorous entry into the building every day. That has changed, and people are getting kind of tired. I can sense people getting a little frustrated at that standing in line to get prepared to go to work. So that changes your day pretty much when you've had that type of interaction when you are coming into work. And I've noticed that has been a tremendous change for me. So what I've done is I started getting there a little earlier so I can beat the line, and that has worked. But that change was drastic in the beginning. What hasn't changed is my home life. We had just bought a house, and we were kind of adapting to moving into a new house, and we were still having the new house